Well, from a malfunctioning website to skyrocketing premiums, millions of Americans are already feeling the burn of Obamacare before it's been implemented. But for our nation's veterans, the dysfunction that seems to go hand in hand with government-run health care is nothing new. Our next guest says if you want to know the future of Obamacare, just ask a veteran how federally managed health care has worked out for them. Captain Pete Hegseth, the CEO for Concerned Veterans of America. Pete, certainly that's an interesting draw, right? So
Sure.
you have veterans who have been on a government-run program, and you're saying, look, if you want to know the future of Obamacare, look right there.
No, that's right. Veterans have been experiencing it for years. Look at the implementation of Obamacare. How many people have been held accountable for that failure? None. No surprise to veterans, because how many people have been held accountable for the dysfunction in the Department of Veterans Affairs? None. Once you release policy into the behemoth that is bureaucracy, there is no accountability, which means you get delays, you get wait times, you get problems with care, and no one held accountable. It's the big difference between the government and the private sector. If you fail in the private sector, there are consequences. Within government, there isn't. And who pays for it? The customer. And that's been veterans at the Department of Veterans Affairs.
Explain about we hear a lot about backlog. Okay, so we have a government-run health program, VA. What happens with the backlog? How many veterans are in it, and what are they looking at in terms of more complicated claims?
Yeah, right now you've got almost 700,000 veterans with pending claims, 400,000 backlogged. These are folks waiting for disability benefits that they've earned from the government. It's a little bit different than access to care, but it's indicative of the types of waits and roadblocks you're going to see when you take something like VA care, which is 8 million veterans, and try to scale it to an entire population. You're going to see those very same wait times and paperwork backlogs. I
guess my natural question is, if this is the wait for our nation's greatest at a smaller number, right? So we have fewer Americans here who are our nation's greatest waiting, okay? What's going to happen to the average American when it goes into a federal system?
No, that's exactly right. You've got 8 million veterans. You've got a country of over 300 million. Veterans, 75% of Americans wouldn't qualify to even join the military on health standards. So it's a healthy population, too, generally speaking. Yeah, there's injuries you're coming back from war and dealing with, but generally healthy. You take the population and put them into a similar top-down government-run system, and it's prone to see the kind of slowdowns and bad outcomes that you've seen at the Department of Veterans Affairs.
And you get a paper problem, too. The VA still does 97% of its claims.
On paper. On paper. So we talk about a website for the government and Obamacare, and they can't even get that right after years of implementation. The Department of Veterans Affairs hasn't even figured out how to take a system of processing a claim and put it online. They haven't been able to do it despite millions of dollars to try to make that system more efficient. Still, veterans are submitting claims on paper oftentimes, which just slows down the process even more.
Refresh everyone's memory about the Pittsburgh. Is it a Pittsburgh hospital?
Yep, Pittsburgh Hospital in 2011. 5 veterans were died of Legionnaire's disease, a waterborne disease that was totally preventable. 21 were sickened by it. And the director of that facility, that regional, instead of getting fired, was given a $36,000 bonus because the system doesn't recognize performance. And that's the big difference, is that bureaucracy isn't held accountable on performance. And this Pittsburgh director was promoted and given a bonus when 5 veterans died on his watch, as opposed to being told, this is unacceptable, you're out the door. That is what unaccountable bureaucrats, how it looks when you actually see it face to face.
So perhaps we'll be seeing Sebelius get a promotion then.
Well, how can someone fail this abjectly, so horribly, and no consequences come because of it? It's because bureaucrats are insulated from that, and they don't feel the pain that veterans have felt. Americans are going to start to feel it, and that's why we're pounding the drum about what Obamacare is going to mean based on what veterans have already seen.
Well, an important comparison, Pete. Thanks for being here this morning.